Hello everyone, I am Dr. Sandhya. I am a consultant obstetrician and gynecologist practicing at Cloudnine Hospital, Sarjapur Road. My special interests are managing high-risk pregnancies. Fibroid removal surgery is known as myomectomy. Myomectomy is usually considered in patients who are having symptomatic fibroid uterus and not responding to medical line of management. The symptoms of fibroid can be heavy menstrual bleeding, constant pelvic pain, severe dysmenorrhea, it can be infertility, or there can be some pressure symptoms in the form of difficulty in urination or difficulty in passing stool. So all these conditions usually we consider removal of the fibroid by surgical method. So any surgery for that matter, definitely there is associated risks and benefits with it. When we are talking about the risks of myomectomy, there can be increased blood loss. Hemorrhage is one of the most common complications that we encounter in any myomectomy surgery. So we always keep blood ready for such patients who are posted for myomectomy. If needed, the blood transfusion may also be considered, and most of the times it will be explained to the patient prior the surgery when it is planned itself. And there are other risks which are associated with myomectomy, which includes infection. There can be wound infection or there can be any pelvic infection, and there is associated damage to the surrounding structures which can occur accidentally, though it is rare with technologies in nowadays practice. And sometimes when we are doing myomectomy, the blood loss can be so severe that it becomes very difficult for us to complete the procedure of myomectomy. There might be 1 or 2 fibroids that we may have to leave behind, and we'll have to close the uterus just to reduce the amount of the blood loss and reduce the surgical time in order to stabilize the patient for that matter, because the patient's life is more important than removing of surgery at that particular time. And there is always a possibility of recurrence of the fibroid. Like already mentioned, there is nearly 10 to 60% chances of fibroids getting recurred in the future, like 5 to 10 years from the time of the myomectomy is done. So recurrence is always a possibility. And once patient undergoes myomectomy, subsequently when she becomes pregnant, there is always need for cesarean section delivery. Uterine scar is always liable for rupture during the labor process, so one will not take that chance. Once the patient reaches 37 to 38 weeks, that is when we have a planned cesarean section delivery for such patients who have undergone previous myomectomy. And very rare complication or the rarest possibility is sometimes if the bleeding is very severe, and with all the measures that we have done to stop the hemorrhage, if the bleeding still continues, and in order to save the patient, we might end up removing uterus, which is in cases of 3% of all the myomectomies that we perform. Of course, any patient who is posted for myomectomy, the hysterectomy consent is always obtained on a prior hand basis, and it will be well informed to the patient as well as the bystanders much before the procedure could be performed.